One of the most perplexing problems in all of medicine is drug response. It is completely heterogeneous in patients. And it's quite confusing and quite difficult to treat patients when the response you get from a medication can vary so widely from tremendously successful response to no response at all, to even worse, harm that occurs as a result of drug therapy. And that heterogeneity remains a critical problem in the practice of clinical medicine. Why the heterogeneous response exists is likely due to genetic variation that all of us have. And the reason why some people respond to a drug and others don't, or some people have an adverse effect when most don't. So those are probably genetic reasons. And the science of coupling clinical pharmacology and human genetics together, otherwise known as pharmacogenomics, is really at the cusp of helping us to understand how to deal with heterogeneous response by understanding how genetic variation plays, what role it plays in managing drug therapy. We have started in this country, in Canada, a network called the Canadian Pharmacogenomic Network for Drug Safety. We've recruited more than 20,000 cases and controls now of serious adverse drug reactions and patients who have successfully taken drug therapy without serious harm occurring. And we have been looking at the genetic variation between people who have serious adverse outcomes and those that don't. And we found some very interesting differences between them. Some actually have resulted in changes in the label to medication that are currently used to reflect the fact that there are these critical differences that can mean the difference between harm to a baby or successful therapy. And that's what the network is aimed to do, is to use the science of pharmacogenomics now at the cusp of giving us the ability to predict in whom harmful responses will occur to make better decisions in the future.